that, but I'm watching it, okay? It's the first sign. It's the least of the offensive sign. Then, watch their eyes. When I first walk into a patient's room, I'm noting where the clock is. You don't have one here, okay, behind the wall. But if I'm in a patient, normally, if their bed and the head is this way, and their bed is here, I'm kind of sitting somewhere on this side, and the TV and the clock are behind me, normally. So I'm going in the room going, TV here, clock there. Remember, Larry, okay? And I'm sitting down, and then they start looking over the clock. They start looking at the TV. A man taught me this 33 years ago when I first started dating my wife. My wife and I, being single, went to this couple's house. And about 10:30, this man said to me, Larry, Sarah wants to go home now. I looked over at her. Did you? She goes, I didn't say anything. And I go, well, how did you come up with that, Jim? He goes, well, she looked at the clock 3 times. I go, wow, I got to learn from this, you know? It was like later on in my training, I go, that's what Jim was doing. He was staying alert. He was wanting to know when the conversation's not right. Okay? So I took her home. But I would have never picked up on that. Same thing with the TV. They may be looking at the TV and going, that's my favorite program, or I'm just not interested in you. I don't know why they're looking at the TV. But for whatever reason, they're not looking at me anymore. So I don't say, well, I guess you don't like my conversation. But you back out of the conversation, maybe change the topic, and then they're looking at you again. Well, it was the topic, okay? Or it may have been, I'm interested in that space shuttle going off at that time. Okay, in fact, well, let's just turn our chair around together and let's watch it. Because if that's more important to them at that time, that's what I'm there for. You go, well, I didn't get to pray my prayer and do my ministry. Yes, I did. I did my ministry. I watched TV together. Oh, I never thought about that being ministry. Or I'm saying when they're looking at the clock, is there a procedure going to happen? Oh, no, I'm waiting for my husband to come. I'm going to pick. I wonder where he is. Do you need to call him? Yeah, would you let me? Sure. My discussion is not more important than their time need. So let's call your husband, see where he is. Oh, thank you, thank you. Because they're not listening to you. They're looking at the clock thinking about the time. Or they were supposed to take me for the procedure at 1 o'clock. Here it is 1:45. And that's all they're thinking about. Would you like me to go to the nurse's statement and see if it's been delayed? Oh, would you please? Hey, this procedure is going to happen with Mrs. Jones this time. Oh, no, it's been delayed. It's going to be 2:30. Thank you. Would you mind going in there to tell them? Not me? Okay, we'll go in there and tell them. And then they're like, oh, okay, 2:30. Good, sit down. We're ready to talk now. You see, it's all about timing their need. Then you need to watch for turning their torso. Here we are kind of torso to torso. And all of a sudden they go, what was I just talking about? Maybe they just had spine surgery, back surgery, and they need to shift. Maybe they're stiff. I don't know why they turned their torso. All I know is they turned their torso, they looked at the clock twice, they're not looking at me now. That's all I know. I don't know why, but I'm taking it in. Then they have this kind of a frown. I just talked about something about my church or whatever that I shouldn't be talking about, or some theology, and they and you go, I guess that struck a nerve. Or they even kind of shook their head no a little bit. So I'm looking for that to see if maybe that's part of their uncomfortable nature. And then they made this kind of or some kind of breathing motion that you're looking for that says something just went wrong in that conversation. Then watch them as they start to say something. I watched a video of a certain very well-known counselor that's supposed to be the best out there in listening. And they showed us a video of him counseling. He interrupted this lady 3 times at such a perfect moment. I would have wished I had known what she was going to say. Here's where we're back to silence. Don't be afraid of silence. Somebody wants me to say something, okay? That's what silence does. Say something. And that's why you feel, I need to say something here. I need it. You don't have to. Just ask a question. Wait for them to talk. They teach us in sales, after you say, would you like to buy this car? The next person that talks loses. If you use the salesperson talk next, you lose the sale. If you use the customer talks next, you lose, you buy the car. Okay? In the same way in chaplaincy, the next one that speaks is the one that's really has charge of the conversation. If you speak, then you just interrupted their thought. They're thinking. You just ask them a question. I'm still thinking. Be comfortable with silence. Watch also for them, let them do most of the talking. Listen for disagreement. They may even say, well, I don't know about that. And then we just keep talking. Beware that some people, like myself, are poker faced. I'm from the Southern culture, Birmingham, Alabama. We don't really just tell what we feel. We're just polite kind of people. So if I were the patient, you came in my room and you started talking about a theology I didn't agree with, I wouldn't say. I wouldn't frown. I wouldn't look away at the clock. I would give you my total respect. And you would think, hey, boy, he believes what I'm saying. No, I don't. When you leave, I'm going, but I didn't tell you. I'm a poker face. What if you're a chaplain who doesn't read people well, and you come across a poker face patient? Ruh-roh. You're not going to communicate. You're going to think you're communicating. In fact, here's what happens with that person that doesn't read well. They crossed their arms and legs. They looked at the clock and the TV. They made kind of a frown. They moved their torso away. They made a kind of a look. And even they said, well, I don't know about that. And you're still talking about your favorite theology. You didn't have a clue that they weren't listening to you because you are one track. And when you left, they go, why does this hospital allow people to come in like that and force that on me? I don't appreciate that. But the person that listened stopped appropriately or close to it and backed out of the conversation or closed the meeting, and they were like, well, that was okay. You know, we kind of got to a little touchy zone. We always do. I mean, in any conversation, you're going to find disagreement. That's the way we are. We use our head, we use our hearts, we disagree. But that's like, okay, high five. So what kind of people read well? Females, left-handed, or truthfully ambidextrous people, because they use both sides of their brain. But left-handed people use the right side of their brain, and it's the more intuitive side. So left-handed people, ambidextrous people, are better at this than right-handed people. And then by way of personality, there are personalities that are more intuitive than others. Those read people better. But here are some people that can learn to read. Males. Sorry guys, I just slapped us in the face here, but we honestly, and ladies don't shout right now, but we honestly don't read people well. And right-handed men don't read people well, and the less intuitive personalities don't read people. But take heart. In the FBI and the CIA and the Secret Service, predominantly those are men, and predominantly they're right-handed, and predominantly they're of the personality that is non-intuitive. And they're teaching them to go into the room and read the room. What if you were protecting the president? They're out there reading the crowd. Who's acting a little weird? They're teaching them to read the room. And that's what I want you, when you go in the room, I want you to read the room. Are there balloons? No balloon. a Bible on the desk, or their own Bible, the Gideon Bible, their Bible.